Could your body be trying to tell you something important? Have you ever wondered if the subtle signs you're experiencing could mean something more? In today's video, we're diving into a topic that could save lives: 9 signs cancer is growing in your body. This video is for anyone who wants to understand how to recognize early warning signs of cancer, whether for yourself or a loved one. Early detection can make all the difference in outcomes, and being aware of these signs could give you the upper hand. We're not just covering the basics. This is a comprehensive guide filled with practical examples, myths debunked, and actionable advice to help you stay informed and proactive about your health. If you find this video valuable, please like and share it to help others recognize these critical warning signs. Your support motivates us to keep creating content that empowers and educates. Don't forget to subscribe to our channel and hit the bell icon to stay updated on more essential health topics. This video is for informational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. If you notice any of these symptoms or have concerns about your health, please consult with a healthcare professional immediately. Let's get started and uncover the signs your body might be showing you. 1. Unexplained weight loss. Imagine stepping onto the scale and realizing that you've lost 10 or 15 pounds without even trying. At first, this sudden drop might seem like a welcome surprise, but unexplained weight loss can be a major red flag that something more serious is happening in your body. While weight fluctuations are common, losing weight without any changes in your diet, exercise, or lifestyle can signal a hidden health problem, one of which might be cancer. So, why does cancer cause weight loss? Cancer cells require a vast amount of energy to grow and spread, and they often alter the way your body processes nutrients. Tumors in organs like the stomach, pancreas, or esophagus can interfere with how your body absorbs food, leading to weight loss that can be difficult to explain. Moreover, the inflammation caused by cancer can trigger a condition known as cachexia. Cachexia is characterized by rapid muscle and fat loss, and it can occur even if you are eating a regular diet. This combination of energy depletion and disrupted digestion can lead to significant weight loss, often without any clear cause. But how much weight loss is considered concerning? Medical experts agree that losing more than 5% of your body weight within 6 months, without any deliberate changes in your eating or physical activity habits, should raise a red flag. For example, if you weigh 150 pounds and suddenly lose more than 7.5 pounds for no obvious reason, it's essential to seek medical attention. Unexplained weight loss of this magnitude can be a sign that something more serious is going on within your body, potentially even cancer. If you notice unexplained weight loss, there are several important steps you can take. The first is to monitor any changes carefully. Keep track of your weight on a regular basis, weekly if possible, so that you can spot any significant drops early. Additionally, consulting a doctor is crucial. If the weight loss persists without explanation, don't wait. Seeking medical advice can lead to earlier diagnosis and better treatment outcomes. In the meantime, you can focus on improving your caloric intake with nutrient-dense foods such as avocados, nuts, seeds, and whole grains. These foods will help you stabilize your weight, at least temporarily, while the cause is being investigated. Furthermore, keep an eye out for additional symptoms. Weight loss paired with signs like fatigue, loss of appetite, digestive disturbances, or pain could point to a more serious issue, and addressing these symptoms together can help doctors make a more accurate diagnosis. Unexplained weight loss is one of those subtle, yet significant signs your body may be trying to communicate something important. Though it might seem harmless at first, this early warning could be a vital clue that something more serious is developing inside your body. Taking prompt action and seeking medical guidance can help you understand what's going on and, in many cases, improve your chances of successful treatment. 2. Persistent fatigue. We all experience fatigue from time to time, especially after a busy day or week, but when that tiredness feels different, more profound and unrelenting, it could be a warning sign that something more serious is going on in your body. Persistent fatigue, the kind that doesn't go away even after a full night of sleep or taking time to rest, is a common yet often overlooked early warning sign of cancer. While it might seem like just another sign of a hectic lifestyle, this level of exhaustion can be a signal that your body is dealing with something more severe. Why does cancer cause fatigue? Cancer-related fatigue occurs because the disease can disrupt the body's normal processes in various ways. Cancer cells require a significant amount of energy to grow and spread. As they multiply, they consume your body's energy supply, leaving you feeling drained. In addition to this, cancer can directly affect the organs responsible for producing blood, such as the bone marrow. For example, blood cancers like leukemia or lymphoma often interfere with the production of red blood cells, leading to anemia, which further contributes to feelings of extreme exhaustion and weakness. Moreover, cancer treatments like chemotherapy or radiation can also leave the body feeling drained, as they target both healthy and cancerous cells, impacting your overall energy levels. So, how can you tell if this fatigue is more than just being tired? One way to assess whether your exhaustion is something to be concerned about is to consider how it affects your daily activities. If you find that no amount of rest helps and your fatigue is making it difficult to perform tasks that were once easy, like getting out of bed, cooking meals, or doing basic household chores, it may be time to seek medical attention. Fatigue that interferes with your ability to function or persists over an extended period is not just a product of a busy lifestyle but could signal an underlying health issue that requires attention. If you are experiencing persistent fatigue, there are several strategies you can implement to address it. One of the first steps is to track your symptoms. Keep a daily log of when you feel fatigued, how severe the exhaustion is, how long it lasts, and any other accompanying symptoms such as shortness of breath, dizziness, or unexplained weight loss. Tracking these changes will help your healthcare provider assess whether the fatigue is linked to something more serious. Next, it's crucial to seek medical advice if your fatigue lasts for weeks and is not relieved by rest. Fatigue that is persistent and unexplained should always be evaluated by a doctor to rule out conditions like cancer, anemia, or other underlying illnesses. Blood tests and other diagnostic tools can help determine the cause. Nutrition also plays an important role in managing fatigue. A well-balanced diet, rich in iron and other essential nutrients, can help your body maintain its energy levels. Foods like leafy greens, lean meats, beans, and fortified cereals are excellent sources of iron, which is important for red blood cell production and overall energy levels. Staying hydrated and avoiding excessive caffeine or sugar is also key to maintaining consistent energy throughout the day. Finally, conserving energy is another practical strategy. If you are feeling persistently fatigued, it's important to prioritize your activities and avoid overexertion. Break larger tasks into smaller, more manageable steps, take frequent breaks, and listen to your body. Overworking yourself when you're already fatigued can make the situation worse, so pacing yourself is essential. Persistent fatigue is more than just a sign of a busy life. It's a potential red flag that your body may be signaling a deeper issue. By staying attuned to your body's signals, seeking early medical attention, and implementing practical strategies to manage your fatigue, you can better understand the root cause and take proactive steps towards safeguarding your health. Don't ignore chronic exhaustion. It could be your body's way of telling you something important. 3. Persistent pain or discomfort. Pain is the body's natural signal that something may not be functioning properly. It can occur for a variety of reasons, from a minor injury to a more serious health condition. However, when pain lingers far longer than it should or doesn't have a clear explanation, it becomes a cause for concern. Persistent pain, especially when it doesn't respond to usual treatments or rest, could be a subtle sign that cancer is growing within the body. It's important to listen to your body and pay attention to discomfort that is out of the ordinary or doesn't seem to improve. The type of pain that may indicate cancer varies depending on the location of the tumor. For example, if you experience chronic headaches that gradually worsen over time, it could be a warning sign of a brain tumor. Persistent abdominal pain that doesn't seem to improve, especially if it's associated with nausea or changes in digestion, could be linked to cancers of the stomach, liver, or pancreas. Additionally, bone pain that feels deep, achy, and is most noticeable at night could signal bone cancer. As the cancer grows, it may press against surrounding tissues, organs, or nerves, causing pain and discomfort. The intensity of the pain may also increase as the tumor spreads, and in some cases, cancer can release chemicals that trigger pain responses, even in distant parts of the body. For instance, Lung cancer can irritate the lining of the chest, leading to chest pain or discomfort that might be misinterpreted as a common respiratory issue. When cancer causes pain, the discomfort often differs from typical aches or pains. While many sources of pain, such as muscle strain or headaches, tend to improve with rest or standard medications, cancer-related pain may not respond as well to common treatments. This makes it important to monitor the pain and how it progresses over time. If pain is persistent, worsening, or does not improve with medication or lifestyle changes, it's crucial to seek medical advice. In addition to pain, other symptoms like unexplained weight loss, persistent fatigue, or swelling around the painful area can provide important clues for healthcare providers. To address persistent pain, there are several practical strategies you can follow. First, pay attention to the patterns of your pain. Keeping a pain diary can be helpful in tracking when the pain occurs, its intensity, and what activities seem to exacerbate it. For example, is the pain worse at night, after eating, or after certain movements? This detailed information can provide your doctor with a clearer understanding of what might be going on. If the pain persists for weeks or becomes progressively worse despite rest or medication, don't ignore it. It's important to seek medical evaluation promptly, as persistent pain can be a sign of a more serious underlying issue. In some cases, seeing a specialist may be necessary. Pain can be caused by a wide variety of factors, but when it's persistent or worsening, particularly if it's accompanied by other concerning symptoms like unexplained weight loss, fatigue, or swelling, it should always be evaluated by a healthcare provider. A specialist, such as an oncologist or pain management expert, can help pinpoint the cause of the pain and determine if further testing is needed. Persistent pain is not something that should be brushed off, especially if it's constant, increasing in intensity, or accompanied by other unexplained symptoms. While there are many potential causes for pain, addressing it early can make a significant difference in your health. Recognizing the signs of potential cancer and seeking medical attention promptly can help improve outcomes by catching the disease in its early stages. If you're experiencing pain that doesn't improve or seems out of the ordinary, don't wait. Consult with a healthcare professional to ensure that your health is properly assessed and managed. 4. Unexplained lumps or swellings. A lump or swelling under your skin might seem like a minor issue at first, especially if it's not causing any pain. However, when a lump doesn't go away, changes in size, or continues to grow, it can be a warning sign that something abnormal is happening beneath the surface. Lumps and swellings are one of the many signals that your body might be sending to alert you to a potential problem, and it's important not to ignore them. While many lumps are benign, they can sometimes indicate the presence of cancer, making it crucial to take them seriously and seek medical evaluation. Cancerous lumps occur when cells in a specific area of the body begin to grow uncontrollably, forming a mass of tissue. This abnormal cell growth can create a lump that may press against nearby structures, cause inflammation, or block normal bodily functions. In some cases, cancerous lumps can also cause swelling in nearby lymph nodes, which are part of the immune system and help filter out harmful substances from the body. When cancer cells spread to the lymph nodes, they may cause them to swell, which can lead to noticeable lumps under the skin. Different types of cancer can cause lumps to form in different parts of the body. For example, a lump in the breast may be a sign of breast cancer, while a swollen lymph node in the neck, underarms, or groin could indicate cancers like lymphoma or leukemia. A lump in the abdomen could be a signal of ovarian cancer or a tumor developing in the digestive tract. Early-stage cancerous lumps are often painless, which is why they may go unnoticed for some time. Over time, however, these lumps may grow larger or change in texture, which can make them more noticeable and concerning. Identifying a suspicious lump requires paying attention to its characteristics. Cancerous lumps are typically hard and immovable, unlike benign lumps, which may feel soft and move when pressed. It's also important to consider the location of the lump. Lumps that appear in common cancer sites such as the breast, neck, underarms, or groin should be monitored more closely. A lump that continues to grow over time, especially if it becomes harder or more painful, should be evaluated by a healthcare provider. Even if a lump doesn't hurt, any lump that persists or changes in size over a period of weeks or months should not be ignored. To help monitor and identify suspicious lumps early, performing regular self-exams is an effective strategy. For example, self-checks for the breasts, testicles, or skin can help you detect changes that might indicate a problem. These exams can be done monthly, allowing you to catch any unusual lumps before they become larger or more concerning. In addition to the lump itself, it's important to note any accompanying symptoms such as unexplained fatigue, fever, or weight loss. These symptoms could be signs that the lump is related to something more serious, like cancer, and warrant further investigation. If you find a lump or swelling, it's important to seek medical advice without delay. A healthcare provider can evaluate the lump and perform necessary tests, such as imaging or a biopsy, to determine whether it is benign or if further treatment is needed. A timely diagnosis can make all the difference in the outcome, as early detection of cancer allows for more treatment options and better chances of recovery. While not all lumps and swellings are cancerous, ignoring them can delay important diagnosis and treatment. Trust your instincts and consult a doctor if you notice any growth that feels abnormal or doesn't seem to go away. Early detection is key to ensuring that any potential health issues are addressed promptly, and taking action as soon as you notice something unusual can lead to a more favorable outcome. 5. Changes in skin or moles. Have you ever noticed a mole or skin change on your body that looks different from the rest? Or perhaps you've observed some unexplained discoloration or changes in your skin. While it might not seem like a major concern initially, these skin changes can sometimes be early warning signs that your body is signaling something important. Skin issues, especially involving moles, discoloration, or unusual marks, can occasionally indicate the early stages of skin cancer, such as melanoma. Recognizing these changes early on can be critical to catching potential issues before they develop into something more serious. Melanoma is a type of skin cancer that develops from melanocytes, which are the cells responsible for producing pigment in your skin. Although not all moles or skin changes are harmful, there are specific features that could indicate a higher risk. For example, moles with irregular edges, unusual colors, or rapid growth should be carefully monitored. It's important to remember that melanoma doesn't always start as a mole. It can also manifest as new skin conditions, persistent sores, or unexplained dark patches. Any changes in your skin that are concerning or out of the ordinary warrant attention. One of the best ways to assess whether a mole or skin change is concerning is by using the ABCD rule, which dermatologists use to identify potential signs of melanoma. A for asymmetry. If one half of the mole or spot doesn't match the other half in shape or size, it could be a warning sign. B for border. Look for moles with irregular, blurred, or jagged edges. Benign moles typically have smooth, even borders. C for color. Moles that have uneven colors or display multiple shades of brown, black, or even other colors like red or blue should be checked. D for diameter. A mole that is larger than 6 millimeters in diameter, roughly the size of a pencil eraser, should be evaluated, especially if it's growing. E for evolving. If a mole changes in size, shape, or color over time, it's essential to seek medical advice. Even small changes can be significant. In addition to monitoring moles, it's important to be aware of other skin changes that could indicate underlying health problems. For instance, jaundice, an unusual yellowing of the skin or eyes, could be a sign of liver problems. Similarly, red, scaly patches on the skin might indicate basal cell carcinoma, a form of skin cancer that's often linked to prolonged sun exposure. These changes may not always seem alarming at first, but they could signify more serious conditions that require medical evaluation. Taking proactive steps to monitor your skin health can be life-saving. One practical strategy is to perform regular self-exams. By checking your skin from head to toe each month, you can keep an eye out for any new or changing moles, discoloration, or other skin abnormalities. Use a mirror to help inspect areas like your back, scalp, and neck, which may be harder to see. Taking the time to familiarize yourself with your skin's appearance will make it easier to detect any changes. Another key strategy is sun protection. Excessive UV exposure is a leading cause of skin cancer, so it's vital to take precautions to protect your skin. Apply sunscreen with at least SPF 30 every day, even on cloudy days, and reapply regularly when spending time outdoors. Wearing protective clothing, such as hats and sunglasses, and seeking shade when the sun is at its peak can also reduce your risk. Documenting any changes in your skin can also be helpful. Taking photos of moles and other skin changes will allow you to track their development over time. This can be especially useful when you visit a healthcare provider, as it provides a clear record of any changes. If you notice any troubling symptoms or changes that persist or worsen, don't hesitate to seek medical advice. A healthcare professional can perform a skin exam and, if necessary, conduct tests like a biopsy to determine whether a mole is cancerous. Knowing your family history is another important factor in skin health. If skin cancer runs in your family, it's essential to be extra vigilant and proactive about skin exams. You may want to consider regular checkups with a dermatologist who can help monitor your skin and catch any potential issues early. Overall, staying aware of changes in your skin, especially moles and discoloration, is an essential part of maintaining your health. Early detection of skin cancer significantly increases the chances of successful treatment and can help prevent the need for invasive procedures. By being proactive about self-exams, sun protection, and seeking professional advice when needed, you can protect your skin and ensure that any changes are addressed promptly and effectively. 6. Persistent cough or difficulty breathing. Have you ever experienced a cough that just wouldn't seem to go away? Or perhaps you've found yourself getting short of breath, even after performing light activities that would normally be easy? These symptoms might initially seem harmless, often attributed to a lingering cold, seasonal allergies, or even stress. However, when they persist without a clear cause or worsen over time, they could be signals of something more serious, such as lung cancer or other forms of cancer affecting the respiratory system. Cancer affecting the lungs or throat can cause irritation and disrupt normal respiratory functions. Tumors in the lungs or airways can block airflow, cause inflammation, or trigger chronic irritation, leading to symptoms like persistent coughing and difficulty breathing. Even in individuals who do not smoke, exposure to environmental toxins, secondhand smoke, or a family history of cancer can increase the risk of developing lung-related cancers. It is essential to stay aware of your body's signals, especially when respiratory symptoms linger or worsen. There are certain warning signs that should not be ignored, as they could indicate a more serious underlying issue, such as lung cancer. One of the first signs is a persistent cough. If you have had a cough that lasts for more than 3 weeks without any improvement, particularly if it worsens over time or feels different from a typical cold or respiratory infection, it could be a cause for concern. Another alarming symptom is coughing up blood, even in small amounts. This is a hallmark symptom of lung cancer and should never be dismissed. Wheezing or whistling sounds when you breathe, especially if accompanied by shortness of breath, can indicate airway obstruction and may be a sign of a tumor affecting the lungs. Additionally, chest pain or a tight sensation in the chest, particularly when coughing, laughing, or even breathing deeply, can signal an issue in the lungs that needs further evaluation. If you experience any of these symptoms, it is important to take action promptly. Tracking your symptoms can help you identify patterns or changes that may require medical attention. Keep a journal to note the frequency, intensity, and any accompanying symptoms like fatigue, weight loss, or fever. This record can be valuable when you consult a healthcare provider. Seeing a doctor early is crucial. Persistent respiratory issues, such as a chronic cough or difficulty breathing, should always be evaluated by a medical professional. Tests like chest X-rays, CT scans, or bronchoscopy may be used to identify the underlying cause of your symptoms. If lung cancer or another respiratory issue is detected early, treatment can be more effective and outcomes are generally better. For individuals who smoke, quitting smoking is one of the most important steps you can take to reduce your risk of lung cancer. Smoking is the leading cause of lung cancer, and quitting can significantly lower the risk of developing the disease, as well as improve overall respiratory health. Additionally, improving the air quality around you is essential. If you live in an area with high levels of pollution or allergens, consider using air purifiers in your home to reduce the number of harmful particles in the air. Wearing a mask in areas with poor air quality, such as industrial zones or heavily polluted cities, can also help minimize exposure to harmful environmental factors. In summary, persistent coughing, Shortness of breath and other breathing issues should not be overlooked, especially if they continue or worsen over time. Early detection of respiratory cancers, such as lung cancer, is crucial for effective treatment and better health outcomes. By staying vigilant, tracking symptoms, and seeking medical advice when necessary, you can ensure that any potential issues are addressed promptly, giving you the best chance for recovery and a better quality of life. 7. Changes in bowel or bladder habits. Have you noticed any significant changes in your bowel or bladder habits lately, such as frequent diarrhea, constipation, blood in your stool, or changes in urination patterns? These symptoms may initially seem like minor inconveniences, but they can sometimes indicate underlying health issues, including cancer. It's important not to ignore such changes, as they can sometimes be a sign of something more serious, particularly cancers affecting the colon, rectum, bladder, or prostate. Cancer in the digestive and urinary systems can lead to noticeable disruptions in bowel or bladder functions. For example, colorectal cancer can result in blood in the stool, which may appear as either bright red streaks or darker, almost black, discoloration. This occurs when a tumor grows in the colon or rectum, leading to bleeding. Bladder and prostate cancers can cause changes in urination, such as needing to urinate more frequently, especially at night, feeling pain or burning while urinating, or seeing blood in the urine. These issues arise when the tumor presses against surrounding organs, disrupting their normal function and leading to painful or abnormal urination. Early detection of such changes can make a significant difference in treatment outcomes, so it is vital to be vigilant about any unexplained or persistent changes in your bowel or bladder habits. There are several warning signs that could suggest the presence of colorectal, bladder, or prostate cancer. One of the most concerning signs is a change in bowel movements. If you experience long-term constipation, diarrhea, or a sensation that your bowels are never fully emptied, these symptoms could indicate colorectal cancer. These changes might be accompanied by discomfort or bloating, which may worsen over time. Another key symptom to watch for is blood in the stool or urine. Blood in the stool, whether it appears as bright red streaks or as dark, tar-like stools, is a clear indication that something may be wrong with the colon or rectum. Similarly, seeing blood in your urine, whether it's a pink or red tint, could suggest bladder or kidney cancer. Frequent urination, especially at night, or difficulty fully emptying your bladder, can be signs of prostate or bladder cancer. These symptoms are often caused by a tumor pressing against the bladder or urethra, leading to urinary urgency or incomplete voiding. Painful bowel movements can also be a sign of an issue in the colon or rectum, as a tumor might cause pain or discomfort while passing stool. If you notice any of these symptoms, it's important to take action and track the changes you experience. Keeping a diary of your symptoms can help you provide clear and detailed information to your doctor, which is essential for proper diagnosis and treatment. Note the frequency, consistency, and any discomfort or blood present, as this information can help your healthcare provider identify the underlying cause. If these symptoms persist for more than a few weeks, it's important to consult a doctor for a thorough evaluation. Early detection of bowel or bladder cancer can greatly improve treatment outcomes, making early intervention crucial. While lifestyle changes like increasing fiber intake and staying hydrated by drinking plenty of water can help with constipation and promote regular bowel movements, they should not be considered substitutes for professional medical advice. It is important to address any changes in bowel or bladder habits with your healthcare provider to ensure you receive proper evaluation and care. In conclusion, changes in bowel or bladder habits can often be caused by less serious conditions, but they can also point to more serious issues, including cancer. It's essential to pay attention to persistent or unusual symptoms and seek medical advice as soon as possible. Early detection and intervention are key to successful treatment, and by staying proactive about your health, you can address potential concerns before they become more serious. 8. Difficulty swallowing or indigestion. Have you been experiencing trouble swallowing, persistent indigestion, or a feeling that food is stuck in your throat or chest? These symptoms might seem trivial at first, often linked to common digestive issues like acid reflux or overeating. However, when they persist or worsen, they can sometimes signal more serious conditions, including cancers affecting the esophagus, stomach, or throat. These cancers can cause narrowing or blockages in the digestive tract, making swallowing difficult and uncomfortable. As tumors grow, they may press on surrounding tissues, leading to discomfort while eating and the sensation of food being stuck in the throat, chest, or upper abdomen. Cancers in the esophagus, stomach, and throat often present with similar symptoms due to their impact on the digestive system. The esophagus, which is the muscular tube connecting the mouth to the stomach, plays a crucial role in swallowing. Tumors in the esophagus can obstruct the flow of food, making it difficult to swallow, or even causing food to back up into the throat. Likewise, stomach cancer can affect the ability of the stomach to properly digest food, causing persistent indigestion. As the tumors grow, they may press against the digestive tract, leading to blockages that cause discomfort and difficulty swallowing. These changes often go unnoticed or are misinterpreted as less serious digestive complaints, but they require careful attention. There are several warning signs that could indicate a more serious issue, such as cancer of the esophagus, stomach, or throat. Persistent indigestion is one of the most common symptoms. If you experience ongoing indigestion that doesn't improve with over-the-counter remedies or adjustments to your diet, it could signal a problem with your digestive system. This symptom should not be ignored, especially if it lingers for weeks or recurs frequently. Another significant sign to watch for is difficulty swallowing. Feeling like food is stuck in your throat or chest, particularly after eating, is a classic symptom of esophageal cancer. This sensation may be accompanied by pain or discomfort while swallowing, which can worsen over time as the tumor obstructs the passage. In many cases, this difficulty swallowing becomes more pronounced when eating solid foods or large meals. Along with swallowing difficulties, unexplained weight loss can also indicate a more serious problem. If you have been losing weight without changing your diet or exercise routine, and you're also experiencing trouble eating, it may suggest that something is affecting your ability to digest and absorb food properly. This weight loss, combined with other symptoms like difficulty swallowing or persistent indigestion, should be a red flag that warrants professional evaluation. Pain while eating, especially in the chest or upper abdomen, can also be a symptom of cancer in the esophagus or stomach. If you experience sharp or burning pain while eating, particularly after a meal, this discomfort may be linked to a blockage or irritation caused by a tumor. If you are experiencing any of these symptoms, it's important to adopt a proactive approach to managing your health. Practical strategies can help alleviate some discomfort, but they should not replace professional medical advice. For example, eating smaller meals more frequently throughout the day may make swallowing easier and reduce the discomfort caused by larger meals. Chewing your food thoroughly and eating slowly can also help prevent food from getting stuck and make swallowing more manageable. However, these measures should not delay seeking medical attention if the symptoms persist or worsen. If symptoms such as persistent indigestion or difficulty swallowing last for more than 2 weeks, it is crucial to seek professional evaluation. A doctor can perform a thorough examination, including procedures like endoscopy or imaging tests, to determine the underlying cause. Early diagnosis of cancers in the digestive system can improve treatment outcomes and survival rates, making timely intervention essential. In conclusion, difficulty swallowing, persistent indigestion, and related symptoms should never be ignored, especially when they persist for an extended period. While these signs might sometimes indicate less serious conditions, such as acid reflux or a mild digestive disorder, they could also point to more serious issues, including cancer. If these symptoms are left unchecked, they can lead to delayed diagnosis and treatment, which can significantly affect your prognosis. By staying vigilant and seeking medical attention at the first sign of trouble, you can ensure a better outcome and potentially prevent more serious complications down the road. Early intervention is key to addressing these concerns effectively and improving your overall health and quality of life. 9. Unexplained bruising, bleeding, or frequent nosebleeds. Have you noticed unexplained bruising, bleeding, or frequent nosebleeds? These symptoms can be alarming, particularly when they happen without any clear cause or seem to occur more often than usual. While bruising and bleeding are sometimes linked to minor injuries or certain health conditions, persistent or unexplained cases could indicate more serious underlying issues, such as cancers affecting the blood or bone marrow. These cancers, particularly leukemia or cancers that impact the bone marrow, can interfere with the body's ability to produce blood cells, leading to abnormal bleeding or bruising. When blood production is disrupted, it can cause a decrease in platelet count. Platelets are essential blood cells that help in clotting and stopping bleeding. Without enough platelets, the body becomes less efficient at repairing blood vessels, making it more prone to bruising and spontaneous bleeding. This means that even minor bumps or injuries may result in excessive bruising, or bleeding may occur without any clear cause. The blood's inability to clot properly can also lead to excessive bleeding from cuts during dental work or even after routine medical procedures. In some cases, individuals may notice a significant increase in the frequency of nosebleeds, often occurring without any apparent reason or lasting longer than usual. There are several warning signs to watch for, which may indicate a blood-related cancer or other underlying health concerns. Frequent nosebleeds are one of the most common early symptoms of leukemia and other blood cancers. If you find yourself having nosebleeds more often than usual or for no obvious reason, it could be a sign that something is affecting your blood's ability to clot. Similarly, unexplained bruising, especially if bruises appear without injury or are unusually large or slow to heal, can indicate a problem with platelet production or function, which is often seen in blood cancers. If you notice that bruises seem to form easily or take longer to heal than expected, it's worth seeking medical advice. Another concerning symptom is excessive bleeding. This could occur from small cuts, after dental procedures, or even spontaneously, and may indicate a problem with blood clotting. If you find that bleeding takes longer to stop than usual, or if it happens even with minor injuries, this could signal a clotting disorder or a blood cancer. In addition to these symptoms, blood in the urine or stool is another warning sign to consider. Blood in the urine may indicate cancers of the urinary system, such as bladder cancer, while blood in the stool could point to colorectal or gastrointestinal cancers. In women, heavy menstrual bleeding or changes in the menstrual cycle, including longer or more frequent periods, could be a sign of endometrial or cervical cancer. While these symptoms could also be linked to less serious conditions, their occurrence alongside other bleeding or bruising issues should not be overlooked. If you are experiencing any unexplained bleeding, bruising, or frequent nosebleeds, it's crucial to monitor these symptoms closely. Practical strategies can help reduce the risk of injury and manage the symptoms, but they are not substitutes for professional medical evaluation. Keep a detailed record of when the bleeding or bruising occurs, how long it lasts, and whether it happens spontaneously or after minor injuries. This information will be valuable for your healthcare provider in determining the cause of the symptoms. If bleeding or bruising persists, seek medical attention without delay. A healthcare professional may recommend a series of blood tests, including a complete blood count, CBC, to evaluate platelet levels as well as red and white blood cell counts. These tests can help identify potential clotting disorders, blood cancers, or other underlying health issues that require treatment. If you suspect that you may have a blood-related condition, don't hesitate to ask your doctor for further diagnostic procedures. Early diagnosis is critical for effective treatment, particularly in the case of blood cancers like leukemia. The sooner a diagnosis is made, the sooner treatment can begin, and the better the chances of managing or overcoming the condition. Ignoring unexplained bruising or bleeding can lead to delayed treatment, which can worsen the prognosis. Therefore, if you notice any unusual or persistent symptoms, it's important to seek medical advice promptly. In conclusion, staying vigilant and paying attention to any changes in your body is vital to maintaining long-term health and well-being. While symptoms such as unexplained bruising, frequent nosebleeds, changes in bowel or bladder habits, difficulty swallowing, persistent indigestion, and unexplained weight loss may initially seem harmless or unrelated, they can sometimes indicate more serious underlying conditions, including various forms of cancer. Although many of these symptoms may be linked to non-cancerous causes, such as infections, stress, or dietary changes, it's essential not to disregard them, as early detection can significantly impact the effectiveness of treatment and overall prognosis. Cancer, when detected early, is often more treatable with a higher likelihood of successful outcomes. This is why it is crucial to seek professional medical advice when symptoms persist or worsen over time. Regular checkups, self-examinations, and staying informed about changes in your body can help catch potential issues in their earliest stages. Additionally, adopting a proactive approach, such as keeping a symptom diary, monitoring your health, and maintaining a healthy lifestyle, can aid in identifying abnormal changes before they become more severe. The importance of early detection goes beyond just improving survival rates. It also allows for less invasive treatments and a better quality of life throughout the treatment process. Taking the time to address any concerns you may have with your doctor, even if the symptoms seem minor, ensures that potential health issues can be ruled out or treated effectively before they progress. Ultimately, by staying aware of your body's signals and seeking timely medical advice, you can safeguard your health, mitigate risks, and take necessary actions that may lead to a positive health outcome. While it's easy to dismiss certain changes as part of normal life, being informed and proactive can make all the difference in your journey toward better health and a brighter, healthier future.